Hello, my name is Diego Piccolo Greenwood, and today we're going to be reviewing 3 different clinical cases and answering a few questions about them. So our first case is a 54-year-old man with an HIV infection present to the emergency department after suffering a grand mal seizure. He has no known personal or family history of seizures. He is afebrile and his vital signs are stable. Fundoscopic examination reveals yellow cotton-like lesions on his retina. Findings on physical examination are otherwise unremarkable. A CT scan of the head demonstrates multiple ring-enhancing lesions in the cerebral cortex. Laboratory findings reveal a CD4 positive cell count of 53 cells per millimeter cubed. Now, some notable aspects of this clinical case is that the patient is HIV positive. He had a seizure. This is why he is presenting to the emergency room. He has yellow cotton-like lesions in his retina, and his CT scan presented ring-enhancing lesions. The most likely cause of the patient's seizure is cryptococcal meningitis. The microorganism which most commonly causes cryptococcal meningitis is called Cryptococcus neoformans and can be found in the soil and bird droppings on any country on Earth. The patient most likely inhaled the spores of this microorganism. Usually, when healthy people come into contact with this microorganism, there is no serious infection due to our immune system successfully fighting it off and keeping it at bay. However, patients with HIV are immunocompromised. Therefore, the microorganism is able to travel through the bloodstream and tends to accumulate in the central nervous system. Cryptococcal meningitis in pregnant HIV-positive patients increases the morbidity and mortality rate of both the mother and the baby. Pregnancy already takes a toll on patients' immunity on top of the HIV infection. This is why there is a very high risk of complications, such as premature labor, among others. Now, since the patient has ring-enhancing lesions on the CT scan, there are a couple conditions that should be included and discarded in the differential diagnosis. Among those are a cerebral abscess, a tuberculoma, neurocysticercosis, which is a parasitic infection, metastasis from other cancers, and a glioblastoma. Now, the appropriate treatment for this condition, we're going to use antifungal medications such as amphotericin B and flucytosine. This is going to represent the induction therapy, or the induction phase of the treatment. And then for the conciliation phase, we're going to use fluconazole. For our second case, we have a 34-year-old Haitian nurse that complains to her physician from occasional rust-colored sputum and a fever of 6 months duration. She also notes her clothes fit more loosely than they used to, and she does not have a history of smoking or asbestos exposure. Her only medication is an oral contraceptive, and an X-ray of the chest is shown. We'll show in a sec. A radiology report expresses concern about the structure indicated by the arrow. This is the X-ray that was taken, and this is the area which the radiology report expresses concern for. So the most likely diagnosis for this patient is tuberculosis. Some of the notable aspects which allow us to make this diagnosis is that she's a nurse, which presents a risk due to her being in contact with possible tuberculosis patients. The rust-colored sputum is also indicative of tuberculosis, and the fact that she has had a fever of 6 months, weight loss, which is very common in tuberculosis patients, and we can rule out some risk factors for lung cancer and other things due to the fact that she is not a smoker and she has not had any relevant exposure to asbestos. The type of lesion that the X-ray shows is a pulmonary nodule. However, due to the fact that it's caused by inflammation due to infection, it is most likely to be a granuloma. Tuberculosis is caused by a bacteria called Mycobacterium tuberculosis. This bacteria is stained with the Ziehl-Neesis stain due to it being an acid alcohol-resistant bacteria. This means that once it is stained, the membrane of the bacteria is resistant to acid and alcohol, therefore it remains stained due to after the cleaning process. And the medium which we're going to use to culture it is the low-stain Jensen medium. However, this does take 1 to 3 months to grow a significant amount of bacteria. Treatment for tuberculosis consists of multiple antibiotics administered over the course of 6 to 9 months, divided by 2 phases. The first phase, we're going to use isoniazid, rifampin, ethambutol, and pyrazinamide. This is going to be for the first 2 months, and then for the second phase, it's going to be a duration of 4 to 7 months, depending on the evolution of the patient, and we're going to use only isoniazid and rifampin. The main side effects of treatment with these agents are loss of appetite, nausea and vomiting, yellow urine and skin, fever for 3 or more days, abdominal pain, tingling in hands and feet, and hepatitis. For our third case, we have a 22-year-old woman who was brought to the emergency room with her roommate, who found the woman lethargic and covered in vomit. The roommate explains that the woman has been depressed lately and that she has a history of epilepsy that is controlled with medications. On examination, the patient is sweaty, jaundiced, and lethargic, with marked right upper quadrant tenderness. Transaminase values are markedly elevated, especially aspartate aminotransferase, with 12,450 units per liter. A serum toxicology screen is sent. The medication on which this woman has most likely overdosed is sodium valproate because of it being one of the most prescribed epilepsy medications. However, it is possible that she has overdosed on carbamazepine due to it also being very common and having similar effects during overdose. The main mechanism for sodium valproate toxicity is the increase of GABA levels in the central nervous system, which functions as a depressor by activating chloride ion channels, resulting in neuron hyperpolarization. Sodium valproate also affects fatty acid metabolism by impairing beta oxidation and impairing the urea cycle. Although there is no known antidote for sodium valproate, these patients are usually treated with activated carbon. Activated carbon binds to active molecules in the body and disables them, preventing them from carrying out their function. Hemodialysis is also recommended and very effective in reducing serum levels of sodium valproate. In some cases, naloxone is administered in patients with severe central nervous system depression. This medication antagonizes opioid receptors in the body. Due to the patient's presentation, the overdose likely happened approximately 1 to 4 hours ago due to the fact that the peak serum concentration of this drug occurs at this time. However, some presentations of the drug, like enteric-coated tablets, have peak serum concentrations 3 to 7 hours after ingestion. The histologic findings and regions of the liver that we could find are microvesicular fat, as well as centrilobular necrosis. Thank you.